Welcome to today's program entitled Addressing Disease Mitigations in Schools, Daycare Centers, and Universities with Sanitizers and Disinfectants. This webinar is produced by the U.S. Environmental Protection Agency's Center for Integrated Pest Management. This is Shonda Bennett with the Center for Integrated Pest Management, and I have the pleasure of being your moderator. The views expressed by our presenters are for educational purposes only and do not represent the official views or positions of EPA or the presenters' organizations. As some of the nation's schools, colleges, and universities and daycare centers have already opened or are in the process of considering reopening, it is critically important that students and children return to clean, healthy learning environments. Today, we will provide some practical information to help schools, universities, or daycare centers develop a pathogen mitigation protocol as part of an overall IPM pest management program. We'll also be discussing best practices for cleaning, sanitizing, and how to select disinfectants, how to read and understand their labels, and the many EPA web-based resources available on these subjects. We are pleased to have with us today a diverse and robust group of experts. I'd like to take a moment to introduce each of them. Janet Hurley is an Extension Program Specialist with the Texas A&M AgriLife Extension. She oversees statewide efforts in Texas to educate public schools about their integrated pest management programs. Next, we'll hear from Brian Burton, who is the Executive Director and Vice President of Mooring USA. He has over 20 years of executive leadership in the restoration and construction industry that includes pathogen mitigation consulting to local governments, hospitals, and schools. Also joining us today is Mr. Ken McPherson, the Pesticide Safety and IPM Coordinator with the U.S. EPA's South Central Region. He serves as subject matter expert and liaison to federal, state, tribal, and local agencies on integrated pest management. Then we'll hear from Dr. Christine Willis, a senior scientist with the Antimicrobials Division of EPA's Office of Pesticide Programs. She leads the program science branch for antimicrobials and before joining the EPA, worked with the Department of Defense and Defense Threat Reduction Agency. We'll begin our presentation with Ms. Hurley.
Thank you, Shonda and EPA, for inviting me to speak today. So yes, today we're going to be talking to schools and others about addressing disease mitigation in your area using sanitizers and disinfectants. But before we get started, we're going to look at this from your indoor air quality and integrated pest management programming and plans. Based on what you already do, this webinar session is designed to help you formulate a better way of how you are doing what you already do and use that guidance to help you navigate COVID within your setting at your buildings. Because even if you're a large school district, some of your buildings are going to be so very different than others based on age, occupants, and where you're located. So our first step is to remember under integrated pest management, inspections are your backbone. Remember that knowing what's where, and we'll get into what's the what. But identification not so much is what is your pest you're dealing with, but for cleaning, sanitizing, and disinfecting, we'll talk about how you identify areas that need specific attention. Monitoring, who can help you to make sure that if an area that you have identified as high is routinely done, or if something needs more attention. That action, who takes action, how do you take action, why do you take action? An evaluation, how does everything work, and then roll together. See, you're doing IPM, but you're just doing it a little bit differently for what's our next steps. So again, that identification. What is a high-touch area versus a low-touch area? If this is a special needs classroom, this was a high-touch area long before COVID, but now what are we making sure we have, what we don't have? Do we want to have this type of soft surfaces? What do we need to make sure that doors are protected? Where are we protecting? Coming in, coming out. We were always limiting people coming in and coming out of buildings, but now what needs routine cleaning? What needs daily, hourly versus once a day versus once a week? This area, we all know that this is a teacher's area, but again, who's touching it? Why are you touching it? Where are we just cleaning? So you have to make these determinations. What's the area that needs high touch at each campus and then low touch? And then as we go forward, what are your thresholds? Again, under IPM, we would have the thresholds to deal with a pest problem. Well, it's kind of the same thing as you're talking about cleaning, because we're going to remove germs. Germs are not viruses per se. Germs are generally bacteria, dirt, impurities from surfaces or objects. Okay, so this is cleaning at its basic. This is where that wash the hands comes in, but it's also cleaning top surfaces with soap and water, some type of detergent. Doesn't necessarily kill the germs, but it removes and then helps lower numbers for spreading infection. Next step, disinfecting. Well, now that kills the germs on surfaces or objects. But again, that uses a chemical to kill germs on surfaces or objects. And we'll get into the finer point a little bit later. But this process does not necessarily clean dirty surfaces. That's step one. Step two, it kills the germs on the surfaces after being cleaned. And again, it further lowers that risk of spreading infection. So you've got cleaning, you've got disinfecting, now you've got sanitizing. Sanitizing lowers the number of germs on the surface or objects to a safe level. Now, this is generally judged by a public health, and what we're going to be using for that standard for the presentation will be what the pesticide label would say. But generally what this works through is you clean the area, you disinfect it, and then you do a sanitation. And generally that's where some of that dwell time comes from, and then when people can come back in. So the monitoring part, remember I said that for monitoring for this, your high and your low touch, those contact areas, well, then what you want is you need help, because this isn't a one-person job at any campus. So yes, you've got your custodians, but your custodians are doing the heavy lifting. But you may have some other people on campus to help you. Generally, you have a school health activities committee, SHAC, so we call it a campus SHAC team. Well, who on that team could also help to be a monitor? Who is in your environmental health department? Who's in your risk management department? What about the campus nurse or just nurses in general? Is there other people within the district that isn't focused on having another job by teaching and or doing something else that can help? Then they can alert for specific needs and then assist with cleaning certain areas, provided they are trained properly. So one of the things to get people over this hump, and this is a real reminder of, while cleaning using soap and water doesn't require a lot of instruction, although I've learned that, doing good old-fashioned elbow grease, people may not understand what that really means, so you might need to instruct on that. But also, how do you do all of these 6 steps? This is a great infographic. You'll be able to get that later on, but understanding that training is for everybody. If you are asking them to do some additional cleaning, other than cleaning up after themselves after they eat lunch per se, but you're wanting them to do disinfecting or sanitizing, then by all means, you really need to train them. Couple of things that you can do to help with that training. One of them is if they're only just monitoring and you want to use this EPA IAQ measurement tracking sheet, what I like about it is it monitors some things that you're already doing in a building. What are your CO2 levels, which you've probably heard a little bit about, relative humidity, particulate matter, temp, airflow. You can also add anything else that might affect the air in your building. The next sheet, which I really, really like, is if you really wanted to make sure that you're tracking for what's going on in your campus building, especially medical wise. This is something, you could talk to with risk management and the school nurse. Asthma, upper respiratory, other diseases and things that could be related to the indoor air quality of the building. You could add seasonal flu. You could add COVID to this. It's a spreadsheet, but it gets you a starting point of, are there additional factors when I am monitoring for my high touch and my low touch? Do I need to be thinking about as well? Because again, if I'm going to be doing all of this sanitizing and disinfecting, not so much cleaning, because cleaning should be done all the time in all areas, because that's how we can keep down the transmission of just simple flu, cold, some of your abdominal stuff that kids pass around. Cleaning can get a lot of that. But when you get into doing the disinfecting and the sanitizing, which is required under a more virulent disease like COVID, then you might want to think about limiting access to types of equipment or people allowed into key areas. In other words, we know about social distancing, we know about spacing out. What areas, so that again, when do you clean? Why do you clean? How do you sanitize? When do you sanitize? Do you disinfect? All those questions. Making sure that there is adequate cleaning supplies. Soap and water. Soap and water is the greatest thing. Establishing times when students aren't present for getting in and doing that deep cleaning, that disinfecting, and that sanitizing. Making sure you get all of those steps. Then it comes down to training. And the reason I'm bringing this up is so that I can explain to all of y'all listening today and those that listen in later. A lot of schools, a lot of times will say, well, it's OSHA, and OSHA standards don't always fall under the schools. And I argue always back is the right to know and that hazard communication standard, that really is something every employer has to be aware of, because if employees are working around a hazardous chemical, and I remember when this came out, and part of it was simple things like copy toner and stuff. Well, now we're talking about using things like aerosol sprays and wipes with harsh cleaners. We as leaders have to train our employees about the involved risk with storing and handling such substances. So what do we train on? Well, every product, I don't care where you buy the product, off of what shelf, they're going to have all of these images with all this fine print, right? Well, what you're really supposed to train on is, how do you use that product? What's the proper use based on the label that you're reading in your hands? How do you store that product? How do you dispose of that product? You also want to look at the safety data sheet. Are there any public health concerns? Are there any personal protective measures that need to be met? If you're using one of the heavier disinfectant or sanitizers, especially if they've got a danger signal word, warning or danger, a lot of times when it talks about personal protective equipment, they're not talking about a cloth or a bandana as a face mask. They are really talking about a heavier duty mask. So it's really important to understand employee health as well as student and teacher health. So these are a list of resources. You'll find them in your handout. I put these in here, and I know that there's a lot of confusion out there. We're going to get to that, but a lot of times I just want people to know there are some really good resources out there already. It's just navigating your world to figure out how to put them in place. So with that, I'm going to pass the baton on to Brian.
Janet, thank you. I appreciate it. My name is Brian Burden. I'm with Mooring Construction and Restoration. And back in March, we became a fairly early adopter of COVID cleaning and disinfecting protocols due to our customers calling us. 7 months later, we've had the privilege of taking part in this panel due to our application experience, really on a national basis, certainly for schools, but for other institutions as well. So our portion of the presentation today is going to be brief and straightforward. We're going to discuss the what, how, where, and when as it relates to COVID cleaning and disinfection, and what we see in the field, what we do for our clients. But the reality is that most of our clients undertake both cleaning and disinfecting using their internal janitorial staff, as was mentioned earlier. Often we're brought in when confirmed cases are discovered and they want a little bit of a deeper clean. As was mentioned earlier, the differences in terminology are important. And you see this slide, cleaning really includes the day-to-day janitorial work performed to keep student and staff spaces clean, whereas disinfection uses an approved chemical and occurs after that normal cleaning cycle is completed. And one thing that I would recommend is that you keep in mind is if the chemical is not on the list that you see there in green, it's not an approved disinfectant. So make sure whatever it is that you are using is on that approved list. And keep in mind the formal definitions that Janet mentioned earlier around cleaning, disinfecting, and sanitizing, and just know that they are in fact 3 different things. Personal protective equipment, or PPE, as was referenced earlier, those requirements are going to be set not only by the individual organizations, but really by the chemicals themselves. The specific chemical that we use, we actually employ the use of Tyvek suits, gloves, goggles, full face respirators, the whole gamut. But a lot of products don't require that level of PPE. Just keep in mind that normal cleaning must be performed prior to the disinfection because it's essential to get rid of the dirt and dust that may block access to the pathogens to allow the disinfectant to do its job. The pre-cleaning instructions, the disinfection dwell time, and the requisite PPE are all located on the labels of the chemicals themselves, and these protocols need to be followed exactly. This is an illustrative example of our COVID cleaning and disinfection process. And in this case, the initial janitorial cleaning would have already been completed. So our spray teams don their PPE, Tyvek, goggles, masks, gloves, and our wipe teams wear the suits, the goggles, and the gloves. And depending on the size of the building in question, we may utilize multiple teams. So in the case of a large school, we might have 2 or 3 different teams going through to make sure that we get it all done in the shortest amount of time. But we spray both the high touch areas and general areas with a mist, and we ensure that the correct dwell time is reached. After that dwell time has elapsed, the wiping teams spray and wipe all the high touch areas. And then based on our individual customer and what they desire, we might also employ a secondary mist upon exiting the room. What you'll see is with the red asterisks there is that, there's many customers don't get to that level of disinfection when doing it themselves, and that's absolutely fine. A simple initial cleaning, a spray with the proper dwell time, and a final wipe can suffice as well. We just have those that wish to go above and beyond, and we offer that as well. In terms of high touch areas, these are examples of the high touch areas along with the recommended daily, weekly, monthly, or quarterly periodicities and the logic behind those recommendations. It kind of makes sense that you would disinfect cafeterias, bathrooms, special needs, kindergartens, the offices, front office, nurses' offices, gyms, band halls on a more regular basis. Those are high contact areas and high potential areas for virus interaction, and they involve young children, sick children, a lot of back and forth. Other areas are more difficult to disinfect daily and would be placed on a longer rotation. But ultimately, that decision is made by the institution themselves. We appreciate the opportunity to share our experience today. I know this is a brief section, but we are a service provider, but we're equally happy to serve simply as a resource. If anyone has any questions, if we can be of assistance, please feel free to reach out via email or telephone. Appreciate your time.
Thank you, Brian. And now we'll hear from Ken McPherson.
Thank you, Shonda. Good afternoon, everyone. It's my pleasure to present to you today. Again, I'm Ken McPherson. I'm the Regional Coordinator for Pesticide Safety and Integrated Pest Management at our Region 6 offices here in Dallas, Texas. Our area of focus that we support are states, tribes, and local communities in Texas, Louisiana, Arkansas, Oklahoma, and New Mexico. So when developing a plan or protocol to mitigate any pathogen in your facility, it's important that you use only disinfectants that are registered with the Environmental Protection Agency to control those specific pathogens. The Environmental Protection Agency registered disinfectants have been evaluated not only for their efficacy for the pathogens listed on their labels, but for their effect on human health and the environment when used as directed. When selecting disinfectants to mitigate SARS-CoV-2, the virus that causes COVID-19, it's important that you only use products that appear on EPA's list in for disinfectants approved for use against COVID-19, or disinfectants that have been registered specifically for use against SARS-CoV-2. Now, you might be thinking to yourself, what's the difference? Well, the difference is that those that are listed on our list in are currently registered for other pathogens that are harder to kill than SARS-CoV-2. So as a stopgap, we have gone through our process and reviewed them and said, we approve these for the use against SARS-CoV-2. But there are some on the market that are registered specifically for SARS-CoV-2 and have been proven to kill that virus. Now, one of the things I really want you to understand is the EPA registration number. The EPA registration number is very important for researching any pesticide product. On the disinfectant label, the EPA registration number will usually be found on the front or back of the label. It will contain 2 to 3 groups of numbers, the first 2 groups being the original registrant's identity number for this product, and if it appears, the third number is for any other company allowed to produce the product by the original registrant of the disinfectant. An EPA registered product, sometimes referred to as EPA approved, means that the EPA has authorized distribution of that product in the United States after considering risk, benefits, and in the case of antimicrobials, efficacy. So how do you find out if your disinfectant is good for the novel coronavirus? It's easy to find EPA's list in for disinfectants for coronavirus COVID-19. Just simply search EPA and list in, and it will often be the very first pick that pops up. I have provided you the link in the source notation toward the bottom. To find if the product you are interested in is on the list, just type in either the EPA registration number, the preferred method, or the product's name. Let's say I have a disinfectant in my hand that has a registration number of 777-66-12. The system will only take the first 2 groups of letters, giving me the original registrant's information, and most important, the contact or wet time in minutes. You can see that right across the bottom here. But the product I have in my hand does not say Lysol brand on it at all. And as we stated, it has those extra numbers. Remember I said 777-66-12. So how do I determine if my product is valid? This is where the EPA's pesticide product label system, or PEOPLES, comes in handy. I type in EPA registration number 777-66-12 that I saw on the label. And what happens is I get a big goose egg. Now, sometimes what you're going to do is you're going to type that number in and you're going to get a list of the name of the product that matches your product. But there are other times where you're going to get this kind of goose egg, and that should be a red flag to you. I recommend that you don't use this product. It is more than likely an unregistered product trying to take advantage of the current situation. Another red flag would be if the product on a different name pops up under the registration number. Another great source for labels for disinfectants and other pesticides is the National Pesticide Information Center's Pesticide Research Online, or MPRO tool. The National Pesticide Information Center is a collaborative grantee with the Environmental Protection Agency that uses multiple EPA data sources to generate information for public use. At this site, we can search for pesticide information based on specific products, their active ingredients, other pests, and many other selections. Notice that when I type in the EPA registration number 777-66, the database lists several products under different names, including one that doesn't even appear to be a Lysol product. These are what we call supplemental distributors, and where the third number comes into play if it exists. Let's click on the last product, 777-66-59441. Notice that this product is registered to the Eastman Kodak Company as a supplemental distributor. Also notice that it has a signal word of warning. I'll talk a little bit more about the signal word later. Let's select the tab View Federal Label PDF at the top center of the screen near the status information. What appears in a new tab is an EPA acceptance letter followed by a 26-page approved label for the original Lysol product registered to Rickett Benckiser, not Eastman Kodak. And I did you the favor by not pulling up the original acceptance letter, but actually started with the label that was approved. This is a label that your Eastman Kodak disinfectant must match for all required and optional language, nothing less than the required language and nothing in addition to the optional language may be on the label. When searching other products, red flags would include any statements of effectiveness that do not appear on this label, or missing precautionary or directions for use, or extra phrases such as safe, natural, pet friendly, those types of things that do not appear on this label. This would include any marketing language used in the sales of this product, whether it's a salesman providing you statements, anything you would see online, or any brochures. Remember what I said before about products that are actually registered for SARS-CoV-2. There are several disinfectants that are now registered that can make effectiveness claims against SARS-CoV-2, the virus that causes COVID-19. But be cautious. We are finding a significant number of violative products that make improper claims of effectiveness against the virus, or how long it's effective against that virus for. When in doubt, visit these sites to see the approved labels. If the product appears with no red flags, it's legitimate. If something just does not add up, avoid using the product. Lots of folks approach us about safety or risk to health. The discussion will eventually lead to the product's toxicity under given situations if the label is not followed. The science behind pesticide toxicity can be a complicated issue to wrap your mind around, so EPA has designed keyword language and some logos that help you decide how to make lower toxic product selection decisions. Remember that when I highlighted the signal word warning in a previous slide, here's where we find out what that means and how it will affect your decision to use it. Danger means that the pesticide product is highly toxic by at least one route of exposure. It may be corrosive, causing irreversible damage to your skin or eyes. Alternatively, it may also be highly toxic if eaten, absorbed through skin, or inhaled. If this is the case, then the signal word poison must also be included in red letters on the front panel of the product label. Warning indicates that the pesticide product is moderately toxic if eaten, absorbed through the skin, inhaled, or it causes moderate eye or skin irritation. Caution means that the pesticide product is slightly toxic if eaten, absorbed through the skin, inhaled, or it causes slight eye or skin irritation. The only pesticide products that are not required to display a signal word are those that fall into the lowest toxicity category by all routes of exposure: oral, dermal, inhalation, and other effects like eye and skin irritation. But notice that up under caution, I also listed category number 4, the lowest category. Many registrants of toxicity category 4 pesticides opt to use caution signal language with any appropriate precautionary statements appropriate for their product. The keep out of reach of children warning is required on all pesticide labels due to the likelihood of contact with children during distribution, storage, and use. Though no direct age is linked to the statement in the Federal Insecticide, Fungicide, and Rodenticide Act, we strongly recommend that any daycare, preschool, or K-12 school not allow children of any age to personally use disinfectants, including disinfectant wipes. Any person who exposes children to pesticides during its distribution, storage, or use, especially if there's an adverse health outcome, could find themselves under scrutiny by federal, state, tribal, or local regulatory agencies, as well as the general public. Please follow the most stringent rules that apply for your locality, or simply just do not let minors use these products. Disinfectants that hold the EPA's Design for the Environment logo have been determined to be low toxicity alternatives. If you see the Design for the Environment logo on an EPA authorized antimicrobial pesticide label, you can be assured that the product is in the least hazardous classes of the acute toxicity category hierarchy. They are unlikely to have carcinogenic or endocrine disruptor properties, unlikely to cause developmental, reproductive, mutagenic, or neurotoxicity issues. EPA has reviewed and accepted mixtures including inert ingredients, does not require the use of agency mandated personal protective equipment, has no unresolved or unreasonable adverse effects reported, has no unresolved efficacy failures, has no unresolved compliance or enforcement actions associated with it, and has the identical formulation as the one identified in the Design for Environment application approved by the EPA. When you visit and scroll down the EPA's Design for the Environment logo for antimicrobials pesticide products webpage, you can review the list of products that are approved to hold this label. Using the EPA's registration number, you can cross-reference this list with those on the EPA list in to help you select the lowest toxic products that will provide you the anticipated control of SARS-CoV-2 that you are seeking. If you get anything out of the presentation today, the most important would be read the label. The general rule to understand is that the label is the law, so it is imperative to understand all statements and follow all directions on the label. So let's look at some of these statements on an actual pesticide label. I've hidden a few items from this randomly selected product label because EPA does not endorse any brand or product over another. On the front of the label, we see just a few items that provided some information for what this product is used for. It's a disinfectant that eliminates odors, can kill 99.9% of viruses and bacteria. The active ingredient list, keep out of reach of children statement, and the signal word caution. On the back bottom of the label, we can quickly identify the EPA registration number to allow us to do some research on this product with the databases we discussed earlier. The EPA registration number may also be on the front of the label of some products. You can also find precautionary statements here, as well as information on how to store and dispose of the product. Notice that this product is supposed to be stored in areas inaccessible to children. At the top of the back panel of the label, we can see a lot of information on what viruses and bacteria that this product is effective against. Note that it is spread out in multiple areas and that there are multiple contact times that vary by pathogen, which are also found in multiple locations. I use some call-out boxes to help you see some of the special instructions. You can also see locations this product can be used at and the sites it can be used on. As a result of the important information and special directions appearing in many locations on the label, it is important that you read the entire label first before you use any product. As before, I want to point out to you the differing contact or wet times for the type of organism that you are trying to control. All too often, we use these products in a spray and wipe fashion, resulting in us not getting the intended control we desire. In the directions for use, you will also note the phrases clean, sanitize, and disinfect. Remember from before, cleaning physically removes organisms with cleaners, soap, and water. Sanitizers reduce the number of organisms in a media or on a surface. And disinfection kills the organism, usually reflected by a percent indicator like 99.9%. To truly disinfect or kill the pathogen, you need to follow the contact or wet times for both the pathogen and the surface you're trying to control the pathogen on. I just want to point out that as we went through these slides, we talked about 3 minutes, 10 minutes, 2 minutes. Those are all significant long periods of time that folks tend not to understand. I cannot reiterate enough about reading the label before using any disinfectant and or decide who will use the product and what training, personal protective equipment, and hazard communications they require. Here you see the precautionary statements for a common disinfectant sanitizer that has the signal word warning. If used improperly without the necessary personal protective equipment and understanding of the hazards, this could be an accident in the making. Note the need to wear gloves, face shield, long sleeve shirt and pants. Notice to avoid getting in skin and breathing. List environmental hazards, open flame hazards, etc. It is extremely important to understand the value of signal words on disinfectant labels and to ensure that staff that use any product, regardless of the signal word, are fully aware how to use the product, where to use the product, and how to protect themselves and others from the hazards of the product. Here you will again see some important web-based information sources to help you make decisions on the selection and use of disinfectants in your schools, daycare centers, and universities. Please remember, select the lowest toxic product for the target pathogen and target site as possible. Read, understand, and follow all label directions, and train and inform your staff. Thank you.
Thank you very much, Ken. Next, we'll hear from Dr. Kristen Willis.
Thank you, Shonda. So today I'm going to be hitting a lot of the same points that the previous speakers have hit on, but they're so important and critical that they bear mentioning again. So before I start describing how to safely and effectively use EPA-registered disinfectants to reduce the transmission of SARS-CoV-2, I want to briefly describe why EPA's pesticide program is involved in the COVID-19 pandemic. FIFRA, or the Federal Insecticide, Fungicide, and Rodenticide Act, is the law that gives EPA the authority and responsibility to regulate any product used to kill pests. In addition to those type of traditional pests like weeds or insects that we commonly associate with pesticide use, microorganisms such as bacteria, viruses, and fungi are also considered as pests. Before EPA registers any antimicrobial pesticide or disinfectant for sale and distribution, we perform a comprehensive scientific risk assessment of the product. We evaluate the entire formulation, including the active ingredient and inerts, and the proposed use pattern to ensure that no unreasonable adverse effects on human health or the environment will occur when the product is used according to the label directions. Disinfectants are powerful for controlling the spread of disease, but they can harm children's health if used or stored incorrectly. That's why you should always follow the label directions. All pesticide labels, including disinfectants, have a child warning statement bearing some variation of the statement, "Keep out of reach of children." And we do this because children are considered to be a sensitive population and that they are less able to read complicated labels or be informed about their risks and more likely to put things in their mouths. These products can be harmful if used or stored improperly. As part of EPA's responsibility to ensure that disinfectants on the market include directions that allow a product to do what it's intended to do without unreasonable risks of harming human health. That only works, though, when you follow the label directions. Keeping products out of reach of children is one part of that. So as Ken already introduced, EPA has developed a list of all of the registered disinfectant products that are effective and approved for use against SARS-CoV-2, the novel coronavirus responsible for COVID-19. List N was first published on March 5th, and at that time, we had about 90 products on the list. 5 months later, with this week's update, we will have over 500 products, and we are updating the list weekly. The List N website is one of the most viewed EPA websites with over 20 million hits and counting. List N is available on the web as well as an app that you can use on your mobile device. Both versions have search functionality for key parameters, including the use site. So for example, home, healthcare, institutional, the EPA reg number, the active ingredient, the product name, the contact time, as well as keyword searches. And we also maintain a page of frequently asked questions about disinfectants for use against SARS-CoV-2, which is updated regularly. So what can you do to ensure that disinfectants are safely used? There are 4 key things to reduce the risks of using disinfectants in children's environments. First, read and follow the label directions. Children, especially young children, should not apply disinfectants. Children should not have unsupervised access to disinfectants, and any person applying disinfectants where children may be present should follow best practices to make sure these products are used safely and effectively. So the best practices for using disinfectants effectively includes choosing a product from EPA's List N. And again, these are the products that EPA expects to kill SARS-CoV-2. Read the directions and follow them. And this is critical. Disinfectants have to be used according to the label. And if you don't, the product may not be effective. For example, if it says pre-clean surfaces before using the disinfectant, make sure to follow the directions and pre-clean the surfaces. Follow the contact time on the label. This is the amount of time a treated surface should remain visibly wet. Disinfectant products take time to work, and all this information is captured in the 6-step infographic, which is on EPA's website. So in order to use disinfectants safely, so some additional best practices, these products are for use on surfaces and not humans. Never apply them to skin or directly to food. Don't mix products unless the label specifically tells you to mix them. Per the CDC's guidelines, wear gloves and wash your hands, as this minimizes your exposure to SARS-CoV-2 and minimizes your chances of inadvertently ingesting disinfectant. If you need to disinfect a surface that touches food, like dishes or kitchen counters, you should choose a disinfectant that's labeled for use in that way. You can find these on List N by searching for food contact surfaces under surface types. For children and adults with asthma or other respiratory issues, you can minimize your inhalation exposure by using wipes or dampened towels, as these produce fewer aerosols than sprays. So some additional resources, or if you have additional questions, we have a number of resources. So general pesticide questions can be directed to the website here, and you can actually submit your question and we will respond. If it's a question about registering a product, you can email the ombudsman, and requests to add products to EPA's List N can go to our disinfectants listserv. And finally, questions about efficacy of the product can be directed to the EPA AD efficacy mailbox. Thank you.
I would like to thank our presenters, Ms. Janet Hurley, Mr. Brian Burton, Mr. Ken McPherson, and Dr. Kristen Willis for sharing their pathogen mitigation protocol experiences and expertise with us. Now we return to your questions for our presenters. Janet, this first question is for you. I thought classroom teachers should focus on sanitizing instead of disinfecting, since sanitizing brings the levels of bacteria to a level that is safe for students, but doesn't require a high level of chemical or such a long wet contact time.
Teachers should be focused on the level of cleaning. And then I would recommend sanitizing and disinfecting for custodial. Based on everything we just went over again, I think cleaning would be their best thing, especially with kids wearing masks and doing social distancing.
Can I add to that? This is Ken. Yeah, so if you go back to what I think all of us have presented a little bit about understanding cleaning, sanitizing, and disinfecting, and each one of them has a very important role in mitigating pathogens. Cleaning helps to physically remove some of the pathogens that are on the surface, but also gets rid of the dirt and the oils and those types of things that would affect any other type of process that you're going to utilize. Some products are registered for sanitizing as well as disinfecting, others are not, right? And the thing is that sanitizing is only going to remove some of those pathogens. And that means you still have active pathogens that would be on the surface. So if we're focused on just sanitizing, there's still a potential that you could have the spread of pathogens in a school, you're just reducing it. In disinfecting, again, the focus is to actually kill the pathogens on the surface. And so when you're determining on the roles of your high touch surfaces that get cleaned more frequently and disinfected versus those that require less attention or longer periods between it occurs, you're going to determine whether you're going to clean, sanitize, and disinfect. But disinfecting is the only way to actually kill the pathogens on those high touch surfaces.
Thank you, Janet and Ken. Brian, this question is for you. I am also hearing from colleagues in the family care and private child care programs that are still having difficulty obtaining enough supplies. Do you have any suggestions?
One of the things that you can do is contact the local public health department. They can provide emergency supplies on a temporary basis. Beyond that, on a more permanent basis, checking with chemical suppliers, checking with third-party janitorial companies, service providers that are doing cleaning and disinfecting. Even Amazon has a lot of stuff out there. EPA website, I believe there's some guidelines on there for bleach and water solutions and alcohol solutions. I'm not sure what supplies we're talking about specifically, but even masks, you can engage kids and parents on kind of an arts and crafts basis for masks. There's nothing specific that is dictating that N95 masks be used. It's really just covering the face.
Thank you. Janet, this question is for you. What does the acronym SHAC stand for?
SHAC stands for School Health Advisory Committee. And if you Google that, you'll find that it's an educational advisory committee that is sponsored by the school board, but also by the CDC and a couple of other environmental health groups. That group tries to work all angles. So when you're talking about the health of a building, that committee would be parents, it'd be teachers, it would be school administrators, a risk manager, a school nurse, the IPM coordinator or a facilities person, somebody in custodial, because as we know, the bigger the building, the more things go on, and this committee's designed to help.
Thank you, Janet. Christian, this question is for you. What does normally required and expected under normal use mean on a product label?
Normal use is probably defined by your own institution and how often you may need to turn over a room versus anything that would be defined specifically on the label.
This is Ken. I think one thing is, how is that phrase used and under what circumstance on the label that might help guide us a little more with that question? Because sometimes the language that's on a label is the response or the definition of how you would react to that is pertinent to all the other information that's associated with that, putting it into context.
Thank you, Christian. Thank you, Ken. On the EPA website, could not find those templates showing at the beginning of the presentation for checklists for classroom to track classroom health. Do you know where I could find those?
And that would be under the EPA Tools for Schools Indoor Air Quality website. They are their checklists. Also, if you've got a mobile device, cell phone, or tablet, if you go into the App Store, you can also download the EPA Tools for Schools app, and those checklists are part of that series of that Tools for Schools Indoor Air Quality.
Thank you, Janet. Ken, this question is for you. For categorization, when you're talking about danger, warning, caution, no signal, is exposure considered as a one-time event or over a period of time? Many products that are being used to disinfect and sanitize are being used repeatedly, so children are exposed over time, especially if products aren't wiped away immediately.
So those signal categorizations are based off of the product. So what happens is that these products, when they're reviewed, will remain on the surface for a short period of time. Many of the active ingredients in these products have what we call very short half-lives. Chlorine is an example. I think the 5% bleach type agents are known to help keep a surface pathogen free for up to 24 to 48 hours. So each one is dependent on the particular active ingredient and then also how it's meant to be used on the label. As long as they're following the label, then there should be no issues that would change what that category is. Remember, the category is the routes of exposure, as in it's a breathing hazard, it causes skin irritation, those types of things based off of that information. And then as long as the label is followed, then the frequency of its use should not be a problem. I think if the label says, and this is just kind of pulling this number out, but if the label says use every 8 hours or no more than 8 hours and you're using it every 4 hours, then you would have a problem. Other than that, there should be no problem based off of the use of the product. As was mentioned by Ms. Willis, the one thing to consider is not mixing these products with other products or cleaners and those types of things, which would change your concern.
So the signal word is primarily derived from the acute toxicology data, and that's the data for immediate exposure, but we also do look at the chronic exposure data to inform the use of the product. So both of those areas are considered when EPA approves a label for a particular product. Just want to make that clear.
One final comment.
Yes, Janet.
Something we do when we do our training, even when we're training IPM coordinators, is we remind everybody the toxicity times exposure equals hazard. The dose makes the poison. Even if you are following all the label stuff, you've got to remember how long were you in that area doing that cleaning, how often. Both Dr. Willis and Mr. McPherson brought that up, but I want you guys to think about that. How often are you exposing anyone to any one thing, and how often is it? And what are the conditions for that? Is it a closed environment? Is it an open environment? Those types of things. Just remember both protecting against one thing, but also protecting humans as well.
Thank you, Janet. This question is for all the presenters. So if a product does not have an EPA registration number, but says it's effective against COVID according to a third party, is it not okay to use?
The short answer is that if there is a product, a disinfectant, that is making any kind of claim with, say, it's COVID, COVID-19, SARS-CoV-2, novel coronavirus, and they're making efficacy claims or inferring that it's for the control of that, and it's not on list N, then it's not advisable to use that product. And any company who is interested in having those products appear on list N need to go through the process with the EPA at headquarters ombudsman to get that listed onto List N. If it is not a registered pesticide, then they need to become a registered pesticide first before they can go through the process to be on List N. Kristen, do you have anything else to put on that?
The only thing I would add is we would not recommend using a product that doesn't have an EPA registration number, because that means we haven't looked at any of the data, any of the efficacy data to ensure it's effective, or any of the safety data to make sure that it won't cause any hazards to the end user. So yeah, as Ken said, making sure that EPA registration number is there is a really critical thing to ensure.
Thank you, Ken. Christian. Ken, this question is for you. Can you speak to the proper ventilation when using disinfectants?
Just like I said in the briefing, and it was kind of repeated by some of the other speakers, it's label, label, label. Ventilation or any other requirements for the use of a disinfectant and what you need to do around that, whether it's the holding, wet time, contact time, whether there is during or post ventilation, all that's going to be on the label. And again, the higher the signal word, the more likely you're going to see some stronger precautionary statements and requirements for these types of things. So there's no simple rule for ventilation and post disinfecting standoff time. It's all dependent on the product and what's written down on the label. So everyone that is, as Janet talked about in the hazard communication portion of her presentation, that even if you have individuals that are actually not applying the product, but they have an interest in that product because they use that equipment or they use that room, it's important to pass on components of that information to them so that they're not left in a void and they understand when it's appropriate to use those rooms or that equipment, again, based off of the pesticide label and the way that it was used by the user.
Thank you, Ken. What is your suggestion, Ken, if a sanitizer has no label?
Let's go back to cleaners, sanitizers, and disinfectants, regardless of the nature of whether it's a product that does all three, whether it's a product that just cleans and sanitizes, whether they're individual. All those products came in an original container with the label. Those products, regardless, and I'm going to talk all three, even though we don't regulate cleaners, when they're moved into another container, some type of label needs to go with them so that the end user has something to refer to. It is a requirement for sanitizers and disinfectants, which are pesticides, that if you move them from one container to another, there needs to be a label be with those products so that everyone that comes into contact with that container knows what the product is, knows the hazard language on there, knows the precautionary statements, and those types of things. So I just want to put that out there. So I know the question was about sanitizers, but there should be no sanitizer or disinfectant that is an unlabeled container. It needs to have some type of label with it.
Thank you, Ken. Janet, this question is for you. We are hearing from the CDC that the virus transmission is greater through airborne and that we should concentrate efforts on ventilation. Is there a recommendation for air purification systems for classrooms?
I have heard that as well. It depends on the age of the building. It depends on your HVAC system. It depends on a lot of different things on what your building can sustain for ventilation. If you have a real old building, adding some of this new stuff may actually drain your system and not make it work efficiently. So this is where you've really got to work with somebody who knows your HVAC system. And this is, again, a campus by campus, not based on a broad spectrum, because again, you could have a 100-year-old building and a 20-year-old building. That ventilation is going to be completely different.
And this is, Ken, there's a couple of trains of thought for indoor air quality and these types of devices. One is whether there's a filtration system that's adequate enough for these types of droplets and those types of things. But then there's also a lot of folks that are looking at what we call devices that are marketed to be able to control different types of pathogens, those types of things in the ventilation system. And I think there's a couple of things that anybody who is looking at purchasing these things is, one, that you need a good consult from a disinterested engineer, like Janet said, to make sure that your facility and equipment is capable of new standards and that they're appropriate. And then two, that you have reviewed all documentation that's presented to you by the person who's producing a device, the one that show that they're an EPA establishment for pesticide devices, but they have documentation that proves to you that that product actually reduces the pathogen in the manner that they're trying to sell you this product, so that you are getting what you think that you're going to get. In many instances, very old schools, sometimes it's easier to open a window than it is to install something like this that might not give you the control that you anticipated, and you actually end up with more problems down the road. And as far as the devices and how EPA reviews devices or doesn't review devices for efficacy, Kristen, do you want to put any input on that, or do you feel the answer was sufficient?
Ken, I think you did a great job, but I'll just reiterate that because EPA doesn't register these devices, that means we don't review the safety or the efficacy data to support those. So as Ken advised, it's really critical that you make sure that you do your due diligence and review that information and get that information from the suppliers. And if I could just add on one other thing, and that is that epa.gov/coronavirus will take you, the second link down, to some good information on indoor air and coronavirus, including some really good FAQs. So if you haven't had a chance to look at that, I would just encourage you to do so with regard to questions about building air, et cetera. Thanks.
Thank you, Ken and Christian. Christian, this question is for you. Is EPA reviewing any products for disinfecting, sanitizing the air?
Yes, we have had some conversations with companies and are currently reviewing an emergency authorization request for products for use in air, which is a slightly different process. It's not something you'd be able to buy in Target, for example. But yes, to answer the question, we are starting to get those type of products with the potential to have some of those approved in the upcoming months.
Thank you. Janet, this question is for you. Many are endorsing fogging for COVID-19. Are there any options from the panelists who could recommend other products to use?
First, the term fogging is not really a term that we utilize for pest management industry, really. So I'll address it in two parts: ultra low volume, which is a true fogging. That's what you see when people are doing mosquito spraying, or when you see somebody trying to control store product pests. In the classroom, many times when you're thinking of fogging is where they're actually using misting devices, whether electrostatic or some other type of misting device. Electrostatic sprayers are just misters, but they're putting a positive charge so that they allow the disinfectant that they're utilizing to adhere to a surface, and it'll actually get up in other areas, like on the bottom of surfaces, on the legs, places where a normal person is walking through doesn't do, where it just kind of falls straight down on a flat surface. The thing is there are disinfectants that's how that they're applied. And then there are disinfectants that basically you're using a bottle sprayer and spraying it on. The key is that all these different products have certain hold times before they're wiped off. And so there's no one method better than another. Though I think that when you read the precautionary statements and directions for use, many of the devices that are meant for misting, there's not supposed to be anybody else in the room other than the person who's applying the product, and the person applying the product is wearing appropriate personal protective equipment so that they're not breathing in the mist and those types of things. So again, it's important about the label. It's important what it says for PPE, and it's important for the precautionary statements about the individuals that may come into contact with that during the application of that product. But after the product's been in place, there's no pro or con for one versus the other once the product is on the surface and has been treated appropriately.
Thank you, Ken. This is also kind of a follow-up to what you just explained. Does the cleaning company have the school clean before they go in and disinfect? And what PPE should they wear and for what purpose?
There are a lot of scenarios where the person who's doing the cleaning and the disinfecting is one and same person. Sometimes they're different people. Cleaning occurs first, disinfecting occurs second, and we've talked about that in a couple of our different slides. You can't get good disinfection unless the surface is clean, but it's important to read the label. Some disinfectants are cleaners and disinfectants mixed together. So they talk about the process to use those like that. But the key is what personal protective equipment that someone who is using any of the products while applying the disinfectants is on the label. And so it's important to read that label. And I'll tell you, the proper personal protective equipment for a cleaner is also on the label. Usually you'll talk about splash-proof goggles and gloves or those types of things. So the information is on the label. You need to read the label, understand the label. But once the disinfectant has been applied to the surface, it's had its contact time, the surface has been wiped and allowed to dry, then the risk to human health and the environment is now very minimal because it was applied by the label on a specific site in a specific area through an intended use, and so the risks to human health and the environment are minimal.
Thank you, Ken. This question is to all our presenters. Can you address any regulations applicable to germicidal UV? This seems to be the most vetted and effective disinfection method when applied properly.
Ultraviolet light in all its different forms out there, whether we're talking about for water, whether we're talking about for air and other devices, it's part of a device. And again, that is all dependent on when anybody decides to utilize ultraviolet light in any type of systems that they're going to use. That's all the way from these little robots that may have UV light to utilizing UV light in air exchange units and those types of things. It's very important to look at the documentation that a vendor is providing you, validate that that information meets to your satisfaction of efficacy before you make any purchase, and that it meets your needs. In other words, that your needs do not exceed whatever research that they're providing you. And not only look at the research that industry is providing you on that product, but do a little bit of your own research to see what other third-party information is out there about the effectiveness of these particular pesticide products in the way that they're being used to ensure that you're getting what you're buying. And it goes back to what Chris and I were talking before, is that even though we require producers of pesticide devices to have an establishment number, we do not review the effectiveness or the effects on human health of a lot of these pesticide devices at the EPA.
Thank you, Ken. This is to Christian. Our school district is using a disinfectant that says it is effective against the human coronavirus. Is this the same as a SARS-CoV-2 or COVID-19? If not, can you explain the differences?
Sure, absolutely. So a SARS-CoV is a specific type of human coronavirus. If the label doesn't specifically say SARS-CoV-2, that means it hasn't been tested against SARS-CoV-2. If it says human coronavirus, it's been tested against a different type of human coronavirus than SARS-CoV-2. However, products that have human coronavirus claims or SARS-CoV-2 claims are on EPA's list N, and we expect them both to be effective against SARS-CoV-2.
Thank you. Janet, this question is for you. If in a gym or dance setting, how frequent should floors be cleaned?
Well, it would all depend. Normal circumstances on cleaning. I mean, I wouldn't do anything, but if you were having a dance, I would probably say after the dance, the floor needs to be clean no matter what, because there was sticky humans there. After a sporting event, it should be cleaned as well. If you're going for the next level, the sanitizing and disinfecting, that's probably not my high touch area. That's probably a low touch area. Kid pukes, there's a whole different array of things on that one, but just everyday use every day.
Thank you, Janet. And this is our last question, and this is to Ken. How long does the virus bacteria stay on equipment?
We are probably not the best folks to talk about how long a virus will stay in the environment. That's more of a medical public health answer. It is important to understand, though, the effects of a particular environment on different pathogens, in that where if a pathogen is outside, it's warm, it's bombarded by sunlight, there's other types of things going on in the environment that could affect how much pathogen adheres to a surface versus it's inside at the right temperature and it's got the perfect medium to stay on. Those are all different factors to play that it makes it very hard for someone like us to answer those questions. But the best way, I think, to go back to this is to think about whether a surface is high touch or low touch to make a determination how frequently it's cleaned and or disinfected. So if you look at like a desk, if a student sits at one desk all day long, then probably it could be cleaned and disinfected at the end of the day. If you have classrooms where many students come to that same site, then you're probably going to have something more frequent. If you're talking about the floors in the hallway, you're probably not going to be, one, disinfecting the floors, but two, you're only going to be doing the cleaning based off of your normal cleaning schedule that you've always had, because the chances of a contact with that surface by someone where they would actually pick up the pathogen are very, very slim. So think of it in that way, not how long the pathogen sits on the surface, but how frequently and how often different types of people come into contact with that surface, so you make the decisions on cleaning and disinfecting those particular surfaces on your scheduled basis.
Thank you, Ken. This concludes our question and answer section. We appreciate your participation and would like to thank our presenters again, Janet, Brian, Ken, and Christian, for an engaging presentation. Have a wonderful day.